I have a question for all those who deal with menstruation. How many times have you dismissed your menstrual pain? How many times have you popped a painkiller and dragged yourself to work while on your period? Is painful menstruation common? Yes, it is. But is it normal? Sometimes, but not always. What physicians usually dismiss as menstrual cramps may actually be indicative of a deeper problem. One of the most common ones is endometriosis. Have you heard of this disease? Do you know its specifics? And if not, I am here to tell you all about it. Hello and welcome to Gravitas Plus. I am Molly Gambhir. Let's talk about endometriosis. What happens in endometriosis is that a tissue similar to the inner lining of the uterus starts growing outside the uterus. It forms lesions on the ovaries, fallopian tubes, the bladder, other areas of the pelvic region. What happens next? It causes inflammation, scarring, and cysts. And what are the symptoms of this disease? The most common one is pain in the lower body. It may be most noticeable during your period, during or after sex, and when urinating or defecating. Some people also experience heavy bleeding during their period or between periods. Infertility, bloating or nausea, fatigue, depression, or anxiety. The symptoms often improve after menopause, but not always. Endometriosis is a chronic disease. Once women get it, it lasts a lifetime. It's also incurable, so there is no way out. The disease affects roughly 10% of women and girls worldwide. That accounts for some 190 million females around the world. It is the second most common gynecological condition in the UK. The exact cause of endometriosis is not known, but the risk increases for those with a family history of endometriosis, people with autoimmune disease or exposure to certain environmental pollutants such as dioxin. Some also suspect a link between endometriosis and bacteria commonly found in the mouth and the gastrointestinal tract. But more research is needed. Endometriosis can start with the periods and can last until menopause. However, some women even experience it in their 60s and their 70s. In fact, the oldest patients have been in their 90s. Many start experiencing pain in their teenage years, but most are diagnosed in adulthood. And why is that? Because their symptoms are often dismissed by female family members and doctors. According to data, more than 60% of women and girls with the disease were initially told by the healthcare providers, most often by their gynecologists, that nothing was wrong. Lack of awareness and education about endometriosis among adolescents leaves many suffering without diagnosis for years. It has also made it difficult to assess how common this disease is among teenagers. In an analysis of more than 1,000 adolescents with pelvic pain who underwent diagnostic surgery, 64% were found to have endometriosis. It's also difficult to diagnose because lesions can be hard to spot, especially in young girls. Imaging tests such as ultrasounds and MRIs are only useful to a certain extent. You see, the standard way to diagnose endometriosis is through laparoscopy. It is a procedure in which a small incision is made in the abdomen and a camera is used to search for signs of endometriosis. It takes an expert's eye to recognize the lesions. In adults, these lesions tend to be dark because they are inflamed and have been bleeding for some time. But in adolescents, they may appear as clear or bright red blisters. Some doctors call endometriosis an invisible disease because those around the patients can barely see it. Those suffering are at times suspected of exaggerating the pain. It is a highly misunderstood and underrepresented disease. But awareness is slowly growing. Myths and misconceptions are also being busted. Did you know that it was earlier believed that women of color don't experience endometriosis? The truth is, of course, they do, but they are less likely to get proper diagnosis as compared to white women. Let's try and look at the solutions now. What are the treatment options for endometriosis? You see, the disease is incurable itself, but some relief can be provided. The symptoms are first treated with medication, particularly for teenagers. Non-steroidal anti-inflammatory drugs are given to treat the pain. Hormonal therapy, including birth control pills, can regulate the hormones. They can slow down or even reduce the growth of endometriosis lesions. Some women find relief by combining conventional treatments with holistic therapies. This includes acupuncture, pelvic floor physical therapy and massage, herbal supplements, and integrative nutrition. According to Healthline, some food items can also help treat endometriosis. So what should you be eating? Fibrous food like fruits, vegetables, and whole grains, iron-rich foods including dark leafy greens, broccoli, beans, fortified grains, nuts, and seeds. Foods rich in essential fatty acids, for example, salmon, herring, trout, walnuts, and flax seeds. Also colorful fruits and vegetables rich in antioxidants like oranges, berries, spinach. And what should you steer clear of in order to rein in endometriosis? Food items that influence hormone regulation, especially estrogen balance. In addition to that, you should limit the consumption of items that can promote inflammation in the body, including alcohol, caffeine, gluten, red meat, and saturated and trans fat. You see, it's important that you take your menstrual pain seriously. It could be endometriosis. So next time, instead of dismissing it, consult your gynecologist.